In the larynx, we have discussed first element in the larynx, that is cartilages of larynx. Right? Now, the second element which we have to discuss is ligaments of larynx. Okay? See here, above the thyroid cartilage, there will be hyoid bone. Is it or not? So this is hyoid bone. There will be membrane which is connecting the hyoid bone to the thyroid cartilage. So that membrane, what we are calling thyrohyoid membrane. This is thyrohyoid membrane. In the lateral part and also in the median part, this thyrohyoid membrane is thickened and forms a ligament. Okay? So that here one ligament is there, here one ligament is there, here one ligament is there. So this is median thyrohyoid ligament. Median thyrohyoid ligament and two lateral thyrohyoid ligaments. And this is the membrane. This is one ligament of larynx, okay, or one membrane of larynx. Then there will be attachment between the thyroid cartilage and cricoid cartilage. Cricothyroid membrane. Cricothyroid membrane. Right? Then after cricoid cartilage, there will be tracheal rings are there. Is it or not? So here trachea will start now from here. This is tracheal rings. Right? In between the cricoid cartilage and tracheal rings, there will be membrane. This is the membrane. This membrane, what we are calling cricotracheal ligament. What is it? Cricotracheal ligament. So, what are the different ligaments which are present in relation with the larynx? Thyrohyoid membrane and ligaments, cricothyroid membrane and cricotracheal ligament. Along with that, one more ligament is there which you have to discuss here. When you take the sagittal section, this is cut section of hyoid bone. This is the epiglottis, and here thyroid cartilage. There will be one ligament which is connecting the hyoid bone with the epiglottis. So this is the ligament which is connecting the hyoid bone with what? With epiglottis. So this ligament, what we are calling hyoepiglottic ligament. Hyoepiglottic ligament. So these are the extrinsic ligaments which are present in relation with the larynx. Recollect once again. Thyrohyoid membrane and ligament, cricothyroid membrane, cricotracheal ligament, then hyoepiglottic ligament. Hyoepiglottic ligament. So these are the extrinsic ligaments of larynx. Then if you go for intrinsic ligament, see here, this is thyroid cartilage, and here you can see this is cricoid cartilage. See here tracheal rings, and over the laminae we can found what is this? Very good, arytenoid cartilage. This is arytenoid cartilage. Over the apex of arytenoid cartilage, carniculate cartilage first, then cuneiform cartilage. And here, in between the arytenoid cartilage and the epiglottis, there is a fold. What is this fold? Airy epiglottic fold. So this is airy epiglottic fold, because we have taken the section like this, right? So that's what we can see only one side. This is airy epiglottic fold. Right? Now, what is intrinsic membrane? Can you take that paper? One small paper. Imagine this is the lumen of larynx. This is lumen of larynx. Within the lumen of larynx, there will be one membrane. There will be one membrane. That membrane, what we are calling fibroelastic membrane. That fibroelastic membrane is intrinsic ligament of larynx. That means here laryngeal cartilages are like this. Inside the laryngeal cartilages, here like this paper, there is a membrane. This membrane is fibroelastic membrane. Right? So this fibroelastic membrane is deficient in the middle, so that this fibroelastic membrane can be divided into upper part and lower part. Are you getting the point? See, this is the fibroelastic membrane which is present inside the larynx or inside the laryngeal cartilages. Right? So that membrane, what we are calling intrinsic ligament, or it is a fibroelastic membrane. Right? So within this fibroelastic membrane, there will be deficiency in the center. That means it is cutting because of sinus of larynx, so that this membrane can be divided into upper part and lower part, and in between there is a gap. Is it? First we will discuss about this one. First we will discuss about upper part. This upper part is having upper border, lower border. Okay, see here it is having the upper border and it is having the lower border, right? So this upper border is going to form airy epiglottic fold, and here lower border is there. So this is the lower border. This is lower border. This is upper border. This is lower border. So this upper border is going to form what? Airy epiglottic fold, and this is the lower border. This lower border is going to form vestibular fold. This is vestibular fold, right? Are you getting my point? So it will be like this. This upper border is airy epiglottic fold. This lower border is vestibular fold. This is vestibular fold. That means two vestibular folds are there. This is one vestibular fold and this is another vestibular fold. The gap between the two vestibular folds, what we are calling rhima vestibuli. What is this? Rhima vestibuli. Since we have taken the section, that's what I have drawn only one side fold, one side vestibular fold. But if you see in the in situ, there will be two folds, right and left folds. This is a gap. This gap what we are calling rhima vestibuli. Okay. So these two are the airy epiglottic folds and these two are the vestibular folds. So this ligament what we are calling quadrate ligament. This membrane has been divided into two ligaments. So upper ligament what we are calling quadrate ligament, since it is quadrangular in shape, right? Then if you take the lower one, this is the lower one or the lower part of the fibroelastic membrane. This lower part of the fibroelastic membrane what we are calling conus elasticus or triangular ligament. Conus elasticus we can also call as triangular ligament, right? So this triangular ligament also having two borders. This is superior border and this is inferior border. Superior border will form the vocal folds. So this is superior border. This is superior border. This superior border will form the vocal folds. And this inferior border. This inferior border will be fuses with or attaches with the cricoid cartilage. It will be attaching to the inside of cricoid cartilage. So this ligament what we are calling triangular ligament. We can also call as conus elasticus. And we can also call as cricovocal ligament because from the cricoid cartilage to the vocal folds. So if you understand this concept, studying laryngeal cavity is very easy. Now we know how upper part has been formed, how lower part has been formed, and how in between the middle part has been formed. Because of the deficiency of this membrane, there is a middle part. That middle part what we are calling sinus. This is sinus. Okay. This is vestibule of larynx. This is sinus of larynx, and this is infraglottic part of the larynx. What I am trying to say here, this is the lower part. This is triangular ligament. It is having two folds. This is one fold and this is another fold, right? These folds what we are calling vocal folds. In between the vocal folds, this is the gap, like our space between the two vestibular folds. Here also there will be space between the two vocal folds. The space between the two vocal folds what we are calling rhima glottidis or rhima glottis. Okay, this is what we are calling rhima glottidis or rhima glottis. Understood? So with this we have described laryngeal cavity also. Laryngeal cavity having the upper part, middle part and lower part. This upper part what we are calling vestibule of larynx. The middle part what we are calling sinus of larynx, or we can also call it as ventricle of larynx. Then the lower part what we are calling infraglottic part. Imagine this is the larynx now. It is having superior part. This is vestibule. This is the sinus in between, and this is the lower part, infraglottic part. What are these two folds? These two folds are vocal folds. These are vocal folds. Usually when you are speaking, okay, that means during phonation, two vocal folds will be approximated with each other, and phonation will happen during expiratory phase only. In that phase only we can speak. During inspiration phase we cannot speak, right? So when you want to speak, these two vocal folds approximated with each other, and expiratory air will be passing between these two folds, passing between these two vocal folds, so that these vocal folds will be vibrated. when these vocal folds are vibrated, sound will be produced. Actually, it is a raw sound. Raw sound in the sense there is no any specific meaning. Once that raw sound enters into oral cavity, because of the manipulation of tongue, teeth, lips, soft palate, gums, cheeks, by all these structures, there will be manipulation to that raw sound, which leads to meaningful language. That we will discuss little later. So what I am trying to say here, there will be always friction between the two vocal folds. When there is a friction between the two vocal folds, there will be chance of tearing of vocal folds. That's what, for the protection or for the prevention of tearing of vocal folds, there will be some protective mechanisms. First one is there should be thickest epithelium. So that's what vocal folds are lined by stratified squamous non-keratinized epithelium. Stratified squamous non-keratinized epithelium. Okay, is that only sufficient? Actually, if there is more friction, even that epithelium may tear. So that's what it needs some lubrication. So from the sinus, just imagine this is the sinus. There will be one saccule will be formed just lateral to the sinus of larynx. Like this, there will be saccule. Just I am drawing with dotted line. This is the saccule. This saccule contains mucus secreting glands. Those mucus secreting glands secretes mucus, and mucus will be poured over the vocal folds so that there is no much friction, so that we can speak without tearing our vocal folds, right? So this saccule, what we are calling saccule of larynx, or we can also call it as oil can of larynx. Saccule of larynx or oil can of larynx. Here only we will discuss about the laryngeal cavity, so that we no need to discuss separately. Laryngeal cavity having the three parts. This is upper part, this is middle part, and this is lower part. This upper part is present in between the laryngeal inlet and the vestibular fold. What is laryngeal inlet here, and what are the boundaries of laryngeal inlet? See here, this is the laryngeal inlet. This is laryngeal inlet. This laryngeal inlet is bounded anteriorly by superior border of epiglottis. Is it? This is epiglottis, right? Anteriorly by superior border of epiglottis. Posteriorly by, what is this? Interarytenoidal fold of mucous membrane. And on either side, what is this? Airy epiglottic fold. Airy epiglottic fold. These are the boundaries of laryngeal inlet. So when they ask laryngeal cavity, we have to discuss first what is laryngeal inlet. Laryngeal inlet is formed by anteriorly superior border of epiglottis, posteriorly interarytenoid fold of mucous membrane. On either side, airy epiglottic folds. Airy epiglottic folds. Then the lower part or lower boundary of vestibule is formed by vestibular folds. In between the two vestibular folds, there will be gap, as we discussed. That gap what we are calling rhima vestibuli. That gap what we are calling rhima vestibuli. Then if you come into the sinus, this is the sinus, the middle part. The sinus is present in between the vestibular folds and vocal folds. These two folds, how they have formed? Because of the deficiency within the fibroelastic membrane. So this area what we are calling sinus. Into the sinus there will be opening of saccule of larynx. This is saccule of larynx. So that saccule of larynx what we are calling oil can of larynx. Then below this sinus, this area what we are calling infraglottic part. This infraglottic part, superiorly it is bounded by vocal folds. In between the two vocal folds, this gap is there. This gap what we are calling rhima glottis or rhima glottis. This is about laryngeal inlet and the laryngeal cavity. Now we will discuss what are the different muscles which are present in the larynx.